Hello, everyone. My name is Anastasia Romashkina. I hold a PhD in medical sciences and work as a dermatologist, cosmetologist, trichologist, and physiotherapist. Today, we will discuss the topic of injections for collagen stimulation using Collost for the correction of stretch marks. We will discuss whether the age of the stretch marks affects the treatment outcomes, what results can be expected, how many procedures are necessary, and of course, we will review the procedure. For the correction of striae, we will use Collost Micro, hydrated using a physiological saline solution with PRP. To hydrate the Collost Micro product, the following conditions will be observed. We will use 3 milliliters of physiological solution and 2 milliliters of PRP obtained by centrifuging the sample in a Y-cell biotube. The patient presents with complaints of decreased skin tone and elasticity in the abdominal area, the presence of stretch marks that developed as a result of 3 consecutive childbirths. For the correction of this striae, we will hydrate the Collost microproduct according to the Y-cell bio PRP therapy protocol. We proceed with the hydration. To reconstitute the Collost microproduct, approximately 1 minute of hydration is required. We perform the hydration by shaking. For the correction of striae, we have selected a protocol using Collost Micro hydrated with PRP. For a PRP preparation, we used a Y-cell biotube, which in this case shows a layer distribution: PPP, platelet-poor plasma, PRP and LPRP, plasma rich in platelets and leukocytes. This is what we will use for our patients. Please note that when we inject the Collost product, which has already been hydrated with physiological solution and PRP, we do so very carefully. We do not shake it further, but simply invert the vial without mixing or agitating it. When using the combined protocol Collost Micro with PRP therapy, we use tubes with sodium citrate as specified in the instructions for hydrating the Collost Micro product. Other tubes are not suitable for hydration. Wrong tubes may result in the formation of sediment, a clumping of impurities, and overall inadequate hydration of the Collost product. I would also like to emphasize that the product is hydrated in 2 stages. The first stage is hydration in the physiological solution, followed by the addition of PRP. In this process, we do not mix, shake, or agitate the previously hydrated Collost microproduct with PRP. Hydrating Collost micros solely in PRP is strictly prohibited because in that case, shaking the PRP will destroy all active platelets. The correction of striae is performed using a linear retrograde injection technique. Ultimately, we inject our product. Preparation for the procedure with PRP therapy and Collost microproduct is essential, involving adherence to a specific diet and adequate fluid intake prior to the procedure. The number of procedures required for the correction of striae depends individually on the number, depth, and volume of the stretch marks. The procedure is performed at intervals of 2 weeks as needed.